Now voice is audible. Is everything is clear and screen is visible? Yes, yes. Thank you. First of all, thank you all joining here. So today we are going to study the art of understanding Materia Medica. So how we can understand Materia Medica in the point of patient, and how we can extract each and every symptom from the Materia Medica book and how we can apply on the patient. So these all are some tricks and an art to understand Materia Medica. So today we are going to understand the Materia Medica from different point of view, how we can view Materia Medica, how we can interlink the symptoms, and most probably many people say that, sir, I cannot remember this symptom, or sir, I cannot remember this remedy. How you can remember? So all these comparison, remembering, and at the same time, whenever you see the patient, immediately you need to go to that remedy. How? So this application will be cleared in this webinar. At the same time, how we can apply the lesser used remedies where many homeopaths stuck there. So how this Medica come into rescue? Now we are going to study about this. First of all, Clark writes, or I think quotes that Clark, who says we must never lose sight of the fact that homeopathy is Medica and nothing whatever else. So this sole one line will help you or will define you how Medica is most important for a homeopath. Either the practitioner or either the beginner or either the UG student, whomever, Medica is the sole code for homeopathy. All other branches of medical study are homeopathic handmaids. By takeaways, Hahnemann's Medica and homeopathy vanishes from the scene. So that in so far as we are homeopaths, Medica is our sole concern. Here he states that if, for example, in a homeopathic medical field, there are different subjects, that is repertory, organon, materia medica, or if we go into the first year's anatomy, physiology, second year pathology, forensic medicine, whatever the subjects we across read in the UG, of this whole soul, if we vanish materia medica or if we remove materia medica from this UG course of homeopathy BHMS, there is nothing else. There is no homeopathy. Homeopathy will vanish from the scene itself. So that much soul importance, you can see how materia medica is important for us. At the same time, at the same vice versa, the other subjects are also important, the repertory and organon. But homeopathy is our sole concern. Homeopathy is our core. Homeopathy is our center to cure the patient, or to learn Materia Medica, or to learn homeopathy, or to learn the pure classical way of prescribing. So we never forgot these Materia Medica, the symptoms, the remedies. How? That is what Clark quotes here. And some other different thoughts from our masters. More says, four requisites to an intelligent study and application of homeopathic Materia Medica should be recognized. First, a thorough knowledge and intellectual understanding of philosophy of homeopathy so far as this is revealed. Here, I want to say, if you do not understand what is the background philosophy of homeopathy, that is the law of similes or law of cure or the universal law of similes, if you don't understand the philosophy of homeopathy, you never understand Materia Medica as well. So this is interlinked. So if you understand the basic law principles what was given by Hahnemann, that will reflect in studying Materia Medica. Here I want to say, for example, if you're reading a remedy Naxomica, now what is the philosophical background of Naxomica you need to understand. If you don't understand the philosophical background or the core from where it is originated, how it is extracted, what symptoms were proven, and how it is proven, what is its main action, if you don't understand the philosophy of Naxomica, you never understand Naxomica and you never understand the philosophy of homeopathy as well. Just reading Naxomica is for gastric complaints, stool, after stool pain, burning, all these cough, coryza. That doesn't fetch you anything. You need to understand what is Naxomica, how is Naxomica, where is Naxomica, how it is extracted, how the old physicians has used that. This is the philosophy of Materia Medica. That you need to interlink with homeopathy. Every symptom is unique. The individualization is important. Coming to the second line here. Second, such as a familiar with the names and appearance and properties of remedies, as comes not only from a knowledge of practical homeopathic pharmacist, but from the personal contact and handling of the remedies themselves. So that is what I am saying. You need to understand the appearance of the remedies, the properties of the remedies, from where they are extracted, how they are extracted. Is it from the soil, or is it from the mineral, or is it from the any animal extraction? That you need to understand. So generally, many people go on reading Materia Medica for hours together without understanding the basic of that remedy. That is most important to understand Materia Medica. Without the basic or the core what you are reading, you cannot understand the gist of the remedy. That is what our masters portrayed to read in Materia Medica. Is it clear? Screen is visible and audible? Yes, yes, fine, thank you. So here, what is genius of the remedy? CM Boger was coined the term genius. So what is this genius actually? From where it is extracted? How we can see the genius of the remedy, the center or the core of the remedy? That if you catch the genius or the core of each remedy, you never forgot the remedy in your lifetime. Even if someone wake up you at night and tell what is Naxomica, you have to tell what is Rustox, what is Bryonia. To understand the depth of each remedy, you need to understand the genius, the center, or I can say the core of the remedy. Many people miss this. They miss the genius and they just go on reading for years together, but they don't remember what is actually Naxomica and when to apply Naxomica or when to apply Rustox, Bryonia, how to see Naxomica patient, how to see Bryonia patient. If you miss this genius, then the time which you spend in your Materia Medica is completely vanished. Nothing else. So how Boger has defined this genius is the strain which runs through every pathogenetic symptom complex has been called genius of the drug. To give this its proper place and prescription should be the ideal of every prescriber. This is, if you understand this line or this para, you will understand how beautiful we can read a Materia Medica. What he writes, the strain which runs through every pathogenetic symptom complex. I can give you an example. To make a beautiful necklace, we need lot of pearls or any gold ornaments, color stones, matching it, keeping in the red color, blue color, yellow color. In between, you keep the pearls and decorate it very nicely. At the end, it will look a beautiful necklace. So how this beautiful necklace is found? Because of the strain which is running through the line of the neck, or you can say the chain. So each pathogenetic symptom complex gives you genius. When you apply that in a proper place, or I can say in a proper place of prescription, that is the ideal. That is where the beautiful necklace is found. That is where the beauty of each remedy is seen. That is where the beauty of results you can see if you apply in the patient. This is the strain. These you need to understand while reading Materia Medica. So how we can understand this genius? What is this genius? And how each remedy portrayed their genius? I will explain further. Genius, the term coined by Boger, is a distillation of the most important symptoms and the pictures of the remedy. That is the center of the remedy. See, understand this line. Many people read on reading many symptoms. Like, for example, if you open rock stocks from the Borig or from the Clark or from the Fatak, etc., you just concentrate on reading mind, head, neck, nose, whatever stomach complaints, respiratory complaints, fine. But you need to distillization, which is most prominent, important symptom of that remedy. That is genius. That is the center. That is the strain which runs through whole remedy. That you need to understand. So to understand the genius, or I can say the important symptoms of each remedy, you need to understand the center of the remedy. Like for example, many people know Naxomica, right? Now, what is the main action of Naxomica? Please text in the chat box. Within 2 lines, you need to understand Naxomica. What 2 lines you need to understand in Naxomica? You just text me in the chat box. Okay, some doctor has said GIT, nervous system, GIT, ambitious, mind, GIT symptoms, GIT, workaholic, GIT, and etc. Right, very good, very good. The answers are right. But what is this GIT? What pathogenetic symptom is running in the GIT? That you need to understand. That is nothing but Naxomica is more of bilious kind of nature. It is a bilious remedy. If you read from Boric, he writes bilious symptoms with headache. The bilious, that is nothing but it is affecting the gastrointestinal system. That is the core. That is where the genius of Naxomica runs through. Now, from that strain, you continue with all the complaints will be matching it. All the complaints will be matching it. Now, one symptom is from GIT is that he never satisfied, or the constipation he goes on once, twice until he's satisfied. That is GIT symptom. Now, if you understand that pathogenetic symptom to the psychosomatic of Naxomica, you will understand the Naxomica ambitious nature, the jealous nature, the workaholic nature. That is the strain, my dear doctors, my dear colleagues and friends. That strain you need to catch in each remedy. We are missing the main pathogenetic strain and go on reading Naxomica 100 symptoms is of no use. And there is one rubric in Naxomica, that is delusion bed sold of his. Here, sold of his bed is nothing but the comfortable position of the Naxomica patient. He is thinking someone is going to grab that position. He is thinking someone is going to sold that position. That is why Naxomica is more of workaholic, more of ambitious. Even Naxomica is indicated in jealous. Elements from loss of ambitious can be Naxomica. Along with that, you can see that strain running in the physical general as well. How you can interlink the psychosomatic and the physical general, or the physical pathogenetic is important here. So whenever you interlink with the mind symptom or the psychosomatic along with the pathological general, you never forget remedy. Never. These you need to fix into your mind. This is the webinar. This is the platform I want to show you, the showcase how we can remember the remedy. It is very easy, my dear friends. Many people are remembering. If 100 doctors are remembering Naxomica very clearly, why we cannot? Why we cannot? Where we are lacking off? That limelight I will be showing in this in this webinar. Essential nature and patterns of the remedy. There is a genius of the case. So if we match the two of our prescription from the true holistic cure becomes more accurate. More accurate. Is it clear? Is it going well? Yes, yes, thank you. So actually this genius, in genius, what are the main symptoms or main subtitles we can look for? So if you correlate the genius along with the subtitles, then the whole remedy picture will be in this genius itself. If you match this genius of the remedy, if you match genius of location with the patient, the pace of the disease, the exciting factor with the patient, the general modality with the patient, the pathological general with the patient, or the general sensation with the patient, the general traits with the patient, the general mental state with the patient, the past and family history with the patient, then your prescription is accurate, then your confidence on your prescription, or then you can say your patient will 100% get cured with this remedy. That is genius. That means you need to match each and everything while prescribing the remedy, not just from one local symptom, not just one general symptom, or not just one unlocal symptom or uncommon symptom. You need to match from the all the spheres of action. When you match these all sphere of action to your patient, your remedy will do wonders. Now to match this all the sphere of action, you need to understand the remedy very very clearly. Now this picture will tell you how you can read Medica. Now I'll tell you a case here of adenoids, which I got in my OPD. Patient has adenoids, and I'll just give you a gist of the case. Patient have adenoids, and the patient is very much tendency for recurrent cold and cough, and patient having profuse sweating. Patient is very cautious, very careful. So these some gist I got it. Now you interlink with that. The location is of more of adenoids in the throat. The action has to be there itself, and the pace is very slow. The exciting factor, you need to find out the exciting factor, that is the cause. So for each remedy you need to look for location. Now as I said, Naxomica, the main location is of GIT, the pace is slow, the exciting factor can be ambitious, workaholic, or any physical generals, that is from overeating, any food disturbances or GIT disturbances, that could be the exciting factor. Here the exciting factor or causative factor is from the both the mental and the physical. That could be in the mental level or that could be in the physical level. Then go with general modalities of each remedy. Then ask, then read the, what could be the pathogenic symptoms or pathogenic generals of the remedy. Then go for general sensation, general trait of the remedy. Now calcarea carb general trait is insecurity, want of protection. How this general trait of calcarea arises? Because calcarea carb is from derived from oyster shell, that is of mineral remedy. Now they seek for protection, they seek for insecurity, the protection either from the relationship or the protection either from the financial or from the money or either from the relationship. That is the main trait of calcarea carb. That is the main trait of calcarea carb. Suppose if you got that trait and you generally link with the pathogenetic general, the main pathogenetic general of calcarea carb is profuse sweating from the head, and weakness you can see, weak bones you can see because of calcium. This is pathogenic general. The general trait you find in a patient conducting with matching with pathogenical general and the general mental state. They are very cautious because they feel that my body is weak. They are very cautious while walking. I may fall. My bones may broken. They feel very boneless. Gutman has described calcarea carb is a boneless person. Boneless person. What is the general trait? They are very fat and flabby. Even calcarea can be thin. General modalities, they are very prominently aggravated from cold. See the trait, match the trait, understand the remedies from different point of view. This is the genius. This Boger has coined this genius term to understand the whole Materia Medica. Whatever remedy you read, just focus on these 9 symptoms or these 9 subtitles. Your Materia Medica knowledge will flourish like anything. You will remember each and every minute symptom of each remedy. This is the genius. This is the genius of each remedy. Is it clear? Is it going good? Thank you. Now, location. As I notice here, location. Some location of the remedies can be in the nerves, can be spigelia, nervous remedy, nervous system action. Glands can be conium, phytoleca, or some other remedies which acts on glands. So you need to differentiate each and every remedy while you are reading it. Bones, the main prominent action on the bones can be rustox, can be bryonia, can be guacum, etc. Some other remedies which action on the bones, calcarea floor, calcarea carb, silicia. This is location. This is location. Why we need to focus on this location is, if a patient who come to your clinic and says, doctor, I am getting joint pains, severe joint pains. Now you're narrowing the remedies to only the particular location, that is bones, or that having action on the rheumatic arthritis, or that having action on the rheumatic diathesis, that you are narrowing. So to get a perfect simillimum single remedy prescription, the only thing you need to do is narrow your vision into your remedies. Narrow your vision into your remedies. Rheumatic diathesis, that could be rustox, bryonia, and you are narrowing the remedies, and you are focusing on the modalities again, and you ask the patient about modalities. When your pain is more, when your pain is less, patient says, my pain is very much while walking, and amel by rest, can be bryonia. Now you have got the location, and you have got the general modality. Now, what is the pathogenical general of bryonia is dryness. Dry mucous membrane. Dry mucous membrane is bryonia. That is the pathogenical general of bryonia. Now you are matching pathogenical general. You have matched location. You have matched general modality. You have matched pathogenical general. And now you are matching the general trait. What is the general trait of bryonia is fear of poverty. They always think of business, talks of business, delirium business talks of. That is the general trait of bryonia. This is the beauty. This is the beauty. This you need to catch in your patient as well as while you're reading Medica. That is what each and every genius, what I have mentioned here is important. Try to interlink. Try to interlink. Connect the dots. Connect the dots. You will get a beautiful picture. You need to connect each and every dot from the patient or from the Medica, whatever you are reading. Just connect it. Now coming into the pace, acute, very slow phase like aconite, very sudden phase like belladonna, relapsing. So if a patient comes and says, doctor, this cold and cough na, or this cold and coryza will come every 1 month, every 1 month, 2 months, 3 months, 4 months, it is relapsing. Here you need to understand the pace is relapsing. The person need the remedy which corrects the immune system, not the remedy for cold and cough. You are getting my point. Why patient is relapsing the complaints? That means there is some derangement in the immune system. That is nothing but the vital force. The derangement of vital force is the main reason for relapsing. If you give remedy for cold and cough, or if you prescribe silicia, heparsol, or aconite, or any acute remedies for cold and cough, that give partial relief. Again, the relapse occurs. You need to give the remedy for the derangement of vital force. So in this relapsing, you need to focus on the past and family history, my dear doctors. Again, why it is relapsing, and if there is a family history of carcinosin, cancer, or any history of respiratory illness, that is the cause for relapse. And here you can think of the remedy nosode as intercurrent. This is the beauty of pace. This is the beauty of pace. If you understand the pace of each remedy, the prescription will go into that line of genius and connecting the dots, and will give you the beautiful results. And understanding the remedy is important. Intermediate China. This is the pace. How the pace is connected, how the location is connected, how the general trait is connected, how the general mental state is connected, how the pathological general is connected, how the causative factor is connected. Try to connect these dots whenever you read any remedy that you, while reading the remedy, you need to imagine, if the patient comes with this remedy, these symptoms, I need to give this remedy. To imagine, you need to understand what is exactly the remedy, what is exactly the core, the center, the crux of the remedy. Boger writings, I have picked up only few some remedies, how Boger describes it remedy, and how important to read Boger synoptic key to understand Materia Medica. And here I could thank to my guru Dr. Jiti Sharma sir, where I learned everything, the Boger synoptic key, the lesser writings of Boger, how beautiful you need to understand Boger, was taught by my guru Dr. Jiti Sharma. I am so much gratitude to sir itself. So here Boger, importance of Boger you need to understand. That is what most important. Many people can't understand these writings. What Kent has written for from many paras, like 2 pages, 3 pages, 5 pages, 6 pages, Boger has written in one line, just one line. That is the beauty of Boger writings. That's why he coined the term genius. If you go to the remedy selenium, easily debilitated by heat of sun, a little mental or physical exertion makes him sleepy. This is the genius of selenium. If you understand this line, if you get this patient says, I am easily debilitated by heat and sun, or little mental physical exertion makes him sleepy. This comes to the, this line or this train runs through the whole remedy. That is selenium. And that's why selenium is an important remedy where sexual desire is high but impotent, because of this easily debilitated, because of this easily debilitated due to mental and physical exertion makes him impotent. This is the selenium. This is the beauty. Spigelia, he writes, spigelia is combined with heart and eye symptoms. That is the genius of spigelia, nothing else. Understand how you can extract a remedy of the genius. Coming to the cannabis state, extreme psychic mobility, exalted ideation, perception with mental excitement, imaginations, and wonderful hallucinations. Now, to understand this cannabis materia medica or this cannabis indica materia medica, first try to understand the toxicology source of cannabis indica. To understand the toxicology source of each remedy, try to read Clerk's Materia Medica, first paragraph, that is the general characters of Clerk's Materia Medica. To get each and every remedy, their toxicology source, please refer Clerk's Materia Medica. That is only the first para, the general characters of that. There you will understand how an old school physician has used this cannabis, how this is poison is extracted, if this is taken in a crude form, what symptoms a patient has developed or that person has developed, that will reflect you the Materia Medica. That is the Materia Medica of the remedy. Coming to Naja, a snake remedy, nervous, excited, tremulous with cardiac effects. Its main action is on cardiac. He describes nitromur in just single line: thin, thirsty, hopeless, poorly nourished. Nitromur patients are thin, they are thirsty, hopeless due to disappointment, love, Wilson past disagreeable occurrences, the grief pattern with emaciation. This is Nitromur. This is the beauty of Boger. These you need to understand. Is it clear? Everyone is very versed with this Boger of this genius and how it is, how to apply. Thank you. We'll go forward. So here I put a case. A girl aged 3 years has had dysentery for 1 week under allopathic treatment and is disseparately ill. Stools almost every hour of bloody water, little mucus with great tenacious before, during, after stool. Anus is raw, bleeding from the discharge. So this is the case. Now tell the remedy, what remedy to be prescribed. Text in the chat box. Yes, mercor, sulfur, mercor, aloes, mercor. Nice suggestions. Abrotinum, fine. Nitric acid. Yes, good suggestions. Cantharis is also someone has written. Thank you for your suggestion. See, now here you need to understand and focus the chief complaint. What it is written: 3 years old, having dysentery for 1 week, under allopathic treatment and desperately ill. Stools are almost every hour of bloody water, little mucus, great tenacious before, during, and after stool. Right. Now, for example, if you add into the repertory sheet, if you add rubrics from Kent repertory, the remedies coming up are Merxol, sulfur, Mercor, and all the remedies are covering all the symptoms what patient has described. Then same with synthesis repertories as well, right? But the remedy given was Mercor. Now you need to understand. Here you need to understand what is the genius of the Merxol, sulfur, and Mercor. So here I want to focus you on, no, many people just do repertory or just add the rubrics, and whatever comes into the top grade they just give that remedy without understanding the pace, without understanding the location, without understanding the sphere of action of that remedy. Never you do that mistake. While repertorization, you may get many symptoms, you may add many symptoms, you will get many polycross remedies as well. Whichever remedy is top, you must not. Whichever having grade marks, you must not give. Before giving that remedy, you need to confirm with the patient, or you need to cross reference the pathogenic symptoms, or you need to cross reference the location, or you need to cross reference the desired aversions, or you need to cross reference the general modalities, or you need to cross reference the general traits. Again, you see how before prescribing, how Materia Medica is most prominent key role plays. Always remember, repertory is also key, but to select the remedy, the final course, the final judge is Materia Medica, nothing else. Nothing else. And the remedy prescribed was Mercor. Many doctors have said Mercor. Congratulations for them. And if you read Mercor, what it is written here from Boric: this salt leads all other remedies in tenacious of the rectum, which is insistent and is not relieved by the stool. The tenacious is often involves the bladder as well. This is the core of the remedy. This is the genius of the Mercor, my dear doctors. This is the genius, right? And see the stool here: dysentery, tenesmus, not relieved by stool. Stool is hot, bloody, slimy, offends you with cutting pains and shears of mucous membrane. Exactly what the patient has described, it is there here. Now if you interlink or if you match these type of exact symptoms into Materia Medica, your remedy never goes wrong. Your remedy never goes wrong. So this is the important you need to understand in the each remedy, the genius, the pattern of remedies. And here you see many remedies are divided into certain types. Constitutional remedies are different, acute remedies are different, chronic remedies are different. But whenever you are prescribing to a patient, there is no acute remedy, there is no chronic remedy, there is no constitutional remedy. Only match with the totality of symptoms. Only match with the patient in front of you, whatever he is saying, what symptom is saying, that is matching to your remedy or not. Many doctors ask, doctor, you give acute remedy or you give chronic remedy, or for example, doctor, CPI is only for women now, why you can give, why we can give for men or not? There is no gender for any remedies. If it is matching with sepia, with male complaint, male symptoms, give sepia, that's all, nothing else. There is no differentiation. Match the totality, match the genius, whomever the patient, either the age is someone, the age is 50, 60, or the adult or the infant, or you can see the symptoms are matching or whatever the symptom. There is no bias with Medica. If symptom is matching with the patient and the remedy, give that remedy, it will work for sure. But it must match the genius of the remedy, it must match the genius of the remedy and the symptomology of the patient as well. That both has to go in hand in hand. Now we'll discuss other case here. This is the case of post chikungunya pains. A lady of age 35 years having chief complaints of pain in the wrist joints, ankles, hands, finger joints. All these pains have started after fever. Pains are so severe that patient cannot able to walk or stand at all. And asking about modalities, she said no relief at all. It pains whole day, but pain is more on motion. Sometimes if I sit, I cannot stand from sitting position. Getting restless due to pains, as well as getting restless due to pains as well. So this was the case. On this basis, I have prescribed phytoleca. Phytoleca was given, but no change. Bryonia was given, but no change. Rustox was given, but no change. On retaking the case again, asking for past history, family history, physical generals, nothing was found. Nothing was found. Now here we homeopath struck. We stuck here. Now what to be given? How to get the patient cured? Now many people blame the system, but we are the failure here. We need to recheck. Now here comes the main role of medical knowledge. Here comes the main role. See, phytoleca was given due to having bryonia like modalities and rustox like modalities. The patient is falling into the category of phytoleca. In between this, that is the reason I have given phytoleca, but no change. Bryonia was given, no change. Rustox was given, no change. Now what we can, how we can think, this is out of the box. Think out of the box. Or the same case, chikungunya, if some other doctor has prescribed bryonia, phytoleca, rostox, guacam, or other some other rheumatic remedies, and patient has said, doctor, I have taken all these remedies, this was the list, but still I'm not getting relief. Either the case taking and patient is not at all giving any information, this was the information. Now guess the remedy, what remedy I have given. Eupatorium, arnica, belladonna, pyrogenum. Good suggestions. And the remedy is polyporous pinacula. I say this remedy had done wonders in my clinic with all post chikungunya pains. When your bryonia, when your phytoleca, when your rustox, or when your rheumatic remedies fails to act, polyporous pinacula comes to rescue. Polyporous pinacula has come to rescue very well. See here, useful in intermediate remnant and bilious fevers with headache. And in the upper limbs or in the generalities, you see what it is written: rheumatic pains in every part of the body. Every part of the body there is rheumatic pains. Worse in damp weather. Hips ache, drawing inside right eye, sharp pain you can see, right tibia, weakness of ankles and feet, walking very difficult, constant rheumatic drawing pains in fingers, wrist, ankles, knees and feet. This is the beauty of polyporous pinacula. This is the beauty of Medica. And this is the beauty of lesser used remedies. We need to master. We need to master. In your clinic, if you master to do acutes, your clinic run wonders. To master such acute cases, you need to master Medica. The art of understanding Medica. And here you see the mind symptom. Despondency with pain, gloomy, melancholic with this pathology, spells depression due to this pain, want to get away out of the sight and lie down. This is the mind state. This mindset matching with the pathology or the physical general or the patient complaints. How beauty. This is the strain of polyporous spinacula. There are some other remedies as well here. They were suggested: Eupatorium perforatum, China, pyrogenum as well. That also works well. But polyporous spinacula, I'm showing in my practice that has worked well with the indications, with the beautiful indications. So coming into the next slide here, every picture has a motive or a central idea which controls the meaning of the whole. Understand this line. Every picture has a motive or a central idea which controls the meaning of the whole. The careful observer tries to find this governing factor first of all, for he knows that it colors the whole scheme and its deduction will simplify the matters. This is the universal lesson which applies with a great force to study of Medica and the therapy. Understanding these line will give you the picture of Medica. Understand the central idea. Understand the motive of the picture, what the remedy want to explain you, what the remedy just is giving you. Take it, take it. If you read one, if you read one remedy for one time, the grasping power from that remedy or the view from that remedy is different. If you read it for second time, if you read it for third time, if you read it for fourth time, if you read it for fifth time, every time you read the remedy, same remedy, the gist you get from that is completely different. Completely different. That is the central idea. That careful observation you need to understand while reading Medica. The universal lesson you need to understand. If you understand that universal lesson, or if you understand the central idea, remembrance will be very easy. Very easily you can remember. Even at nights, if someone calls you and tell what is Naxomika, where it is, you will for sure. 100%. If you understand the central idea, if you understand the whole picture, the crux or the gist of the remedy. Now, the relationship of case taking to the Medica study, I want to explain very clear here. How you can relate this case taking with Medica study. Like, for example, if a patient comes with a complaints of skin eruptions with lot of boils or carbuncles or with pus, and you have given heparsulf, it you have given heparsulf and it has given cure, and but again there is reoccurrence or relapse. Here I want to tell you the sphere of action, how Medica is vast. That is what I want to say you. Heparsulf was given for pus with carbuncles or boils, and you have prescribed, it fails to act, right? Cilicia was given, it fails to act. Now here many homeopaths got stuck there. While prescribing heparsulf, the patient is not getting better. Again, you change the remedy silicia. Again, the patient is not getting better. Now many patient or many doctors say, "Are yaar, heparsulf was given, silicia is going. These are the top remedies for carbuncles or with pus discharges, having skin eruptions with pus discharges, or recurrent boils, etc. Abscess. But heparsulf is not working. Silicia is not working. Now here we struck. Here we struck, right? Everyone struck here. Now what to be done? What to be done? How to cure the patient? Now the remedy comes to your rescue. The Materia Medica remedy comes to your rescue is Myristica sebifera. Myristica sebifera, right? I will answer your doubts for sure, right? At the last, at the end. Here the remedy comes Myristica sebifera. Now, why Myristica sebifera can be given if heparsulf and silicia is failed, right? Everyone, why Myristica sebifera is given? If someone say we can give Marxol or we can give some other remedies, why Myristica was chosen, right? In Materia Medica, it is clearly written. And if Dr. Manoj is available here, please unmute yourself. Dr. Manoj, fine, no issues. So here see why Myristica sebifera was given. If someone have Boric Metromedica right now with you, please open Boric Metromedica. First paragraph at the last, it was written Myristica sebifera acts more powerful than hypersulfan silicia. If someone has Boric Metromedica, you just open it. Yes, someone has texted here. Yes, hypersulfan silicia fails to act. Yes, is it audible, Dr. Manoj? So here, see, if you read Boric of the last line, it was written when Myristica sebifera is more powerful than hypersulfan silicia. It was written. It was written in Metromedica. This is the beauty. We search some other remedy. Why we cannot try Myristica sebifera if hypersulfan silicia fails? It was mentioned in Boric Metromedica. Like for example, if Myristica sebifera is failed, try for gunpowder. In gunpowder, it was written it chronic abscess, chronic suppurations. This remedy helps well. Gunpowder, and gunpowder is a mixture of heparsol, silicia, and Myristica as well, with lot of blackish discoloration. It is from the carbon group of remedy. The skin discoloration is blackish. Gunpowder comes to your rescue at last. Like for example, gunpowder is also failed. The remedy comes to your rescue is anthracinum. If you open Metromedica of anthracinum of any Metromedica, it was written that chronic abscess, malignant ulcers, malignant carbuncles, malignant boils or recurrent boils, anthracinum works well. Even in cancerous cases with lot of pus formation or skin complaints, anthracinum do wonders. Do wonders. Now, what is this anthracinum? Anthracinum is a mixture of nitromure like mind state, the grief, the wills and past disagreeable occurrences, with arts like burning. This is anthracinum. This is the beauty of anthracinum. The skin. See how beautiful the Metromedica. If you know each and every remedy, the genius, you can interlink. We are not going to stop at hepar and suggest the patient to go for some other doctor that I cannot cure. If you given silicia, it is not curing. Go for myristica, go for gunpowder, go for anthracinum. If anthracinum is not helping, go for tarantula cubans. If tarantula cubans is not helping, go for hypoxinum. If that is also not helping, go for staphylococcinum or streptococcinum, the nosodes. This is the beauty. My dear friends and colleagues, here I want to say you how vast is Metromedica, how we can extract each and every symptom from Metromedica. You need to understand. Like for example, if you are about to read Heparsol of the skin, try to compare with other remedies from the Metromedica. What other having the action of same abscess and carbuncles, what remedy should be coming close to Heparsol? Try to dig it, try to search it. To search or to try to dig, you need to understand the main genius of action of each remedy. Is it clear? Is it going well? Is everything is going very fine with you? Thank you, thank you. We'll go for next. Same patterns, same patterns. Now you in a joint pain case or in rheumatic diathesis or in rheumatic joints, patient has given bryonia or rustox or phytolica. There is no help with that. Now we struck here. Everyone struck here. Even I was struck with phytolica. I was struck with bryonia and rustox. I referred to some other doctors that I cannot cure. But once if we master Materia Medica, the narrowing of the remedies, the vision of seeing the patients, the vision of learning remedies will be huge. There are many remedies. Guacam. Guacam is the remedy where if you have a patient who is having past history of tonsillitis with recurrent of tonsillitis with rheumatism, guacam. The other remedy comes into your rescue is streptococcinum. Staphylococcus with same recurrent tonsillitis with guacam. This is the remedy. Phytolica falls between bryonia and rustox with electric-like shock pains. Electric-like shock pains. The other remedy comes to your rescue is stellar media. Stellar media is having shifting joint pains like calibi, like pulsatilla, like caninum, with lot of restlessness like rustox. This is the beauty. Everything is there in Materia Medica, my dear friends and colleagues. Everything is exactly written in Materia Medica. If you read stellar media, you will understand. If you read Stillingia, chronic rheumatism, it was written. If you read radium bromide, chronic rheumatic arthritis, it was written. Try to interlink. Try to interlink. Whenever your main remedies fails to act, go for these lesser used remedies. Go for these lesser used remedies. Connect these lesser used remedies. If radium bromide is failed, go for formica rufa. And interestingly, many people think formica if rufa is for arthritic joint pains. But Boric has written, if you read Boric Materia Medica or Fatak Materia Medica, there has written it has influence in nasal polyps. It has influence in nasal polyps. Formica rufa. This is the beauty of Materia Medica. Many people stick formica rufa is joint pains bus itna hi. But formica rufa is a good remedy, and Boric has written in bold letters. Fatak has also written that it has action on nasal polyps. It has action on nasal polyps. Formica rufa. The other remedies here I have nasal polyps is sanguinaria nitricum having nasal polyps. Pucrum marum verum having nasal polyps. Lemna minor has nasal polyps. This is the beauty. If someone has spoken, or if you are in a discussion in the college, friends or outside, they are discussing about some other pathologic nasal polyps, then try to interlink the remedies. What could be there in our Materia Medica? Immediately go to repertory, search for nasal polyps. You will get enough number of remedies. From that, pick up the high grade remedies. Go to Materia Medica, search for it. How nasal polyp is differentiated for formica rufa, lemna minor, sang nitricum, some other remedies, tucrum marum verum. If you read tucrum marum verum from Nash Materia Medica, he writes give for any nasal polyps give 50 ml, it will cure. That is Nash experience. Try to grab knowledge from Nash. Try to grab knowledge from Boric. Try to grab knowledge from Fatak sir or Fatak Materia Medica. Connect it. Connect it. Make your own Materia Medica, and you will be the master of each remedy. You will be the master of each remedy. This is the beauty. Is it clear? Is it going well? Thank you. Some random remedy discussions. Anthracinum, as I said, blackishness on emotional and physical level. See, the skin complaints are rows of blackish discoloration, a lot of burning, arsenic burning, and at the emotional level, there are also blackishness, the grief, the silent grief, like nitromute. They bottle up their emotions like nitromute. This is anthracinum. Coming to antimonium crudum, emotional, sentimental affections of stomach with white coated tongue. This is the genius of antimonium crudum. If you open Fatak repertory, love sick, there are two remedies. One is antimonium crudum, other one is Tila europea. Only two remedies for love sick. And now, here you need to come again the final code, what to be given. Either you need to give antimonium crudum or either you need to give Tila europea. How you need to confirm? If he is having white coated tongue or if he is having any affections on the stomach, and go with antimonium chloride. In Tila europea, the main objective find of symptom is heel crack. Deep heel cracks with lovesick is Tila europea. And interestingly, lycopodium patient also having heel cracks. But that is different again. Here, Lausic with deep heel cracks. In synthesis, only single remedy, Tilia europea. And how loud, as I said, heel crack is lycopodium. Whenever I am about to prescribe lycopodium and I'm thinking the patient is lycopodium, I just confirm that if there is any heel cracks. That is the genius. That is the genius. That trait runs. That trait runs. And desire for warm food and warm sweets is the trait of lycopodium. See how a physical pathological general is ruling out your remedy. You need to understand. Asaram, oversensitivity of nervous system and mental overexertion. This is the genius. Even the slightest paper noise cannot. That is the hysterical of Asaram. This is the hysterical. Ignitia is hysterical. Valeriana is hysterical. Asafoetida is hysterical. Now the term hysterical is mentioned. Go with some other remedies. Search other remedies. What is hysterical? Open your repertory. Type hysterical. What remedies are there? Come to Materia Medica. Open it. How hysterical they are. In what sphere they are hysterical. At what intensity they are hysterical. At what pace they are hysterical. This is the beauty. Everything is lies in your Materia Medica. The passion you need to develop to learn Materia Medica. They cannot take the least pressure, cannot tolerate any stress that excites them, the strong light, strong noise, strong wind, any kind of violence. See how intensified the symptoms was written in Materia Medica. Strong light, strong noise, strong wind, sensitive to noise. This is the intensity, this is the pace, this is the pace of the remedy. You need to understand each and every line which was mentioned in Materia Medica is having so much of depth meaning. You need to catch hold of that. I have collected some information here. See, acute effects with chronic effects can be ignitia. Sadness with depression is aurum. Sadness with indifference or suicidal, phosphoric acid. Sadness with irritability, nitramur. Sadness with disgust is sepia. Sadness with tearfulness is pulsatilla. Sadness with quarrelsome is Staphysagra. Sadness with hysterical is Simsifica. And interestingly, Simsifica is the remedy comes very close to ignitia. Very close to ignitia. Here you see the exciting factor. I am concentrating on the genius. From the genius, the exciting factor. What is the exciting factor here? The sadness, the grief. In every pattern, there is sadness, 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 sadness. But what was the trait that runs here? The depression trait is aurum. The indifference trait is phosphoric acid. The exciting factor is same, but the trait is different. The trait is different. These you need to understand from the remedy. Matching with the exciting factor and the general trait and the general mental state, what it is. Here comes the beauty. Is it clear? Is it fine? So coming to alumina, the patient is slow as if confused. Actually, I have kept this alumina here is, I got a case actually, and the case of a girl who was complaint of some GI complaints. And I was taking the case, and a chief complaints has completed, past history has completed, family history has been completed. Then I came for desires and asking the desires for the patient, like what you have cravings for eating. Immediately his father said, doctor, she likes pizza, burger. Then immediately the patient reacted, Papa, here also you will say everything. What I eat, why you will say? Doctor has asked me. Why you are saying? Here I confirm the remedy is alumina. This is the beauty. The observational factor is important. Here, what is happening? And then I ask the patient, why? What happened? Why you have reacted? Doctor, now everything my father is controlling. I don't have an option to take. I don't have an opinion to take. Everything my father is controlled. Alumina patient. If you open repertory, delusion under superhuman control, alumina is the remedy. Delusion, his head belongs to someone, alumina is the remedy. Delusion, he or she is robot, aluminum is the remedy. See how a pattern of desires At the desire level or at the physical level, we have selected the remedy. That is why alumina patients are slow, confused, whether to go, whether to come, whether to take decision or not, whether to go for some other tour or not. They are confused because they are dominated, because their head is not belongs to them, their head is belongs to their parents under superhuman control. This is the genius, this is the trait of alumina. These you need to understand in each remedy. The mind is slow, dry as if paralyzed, and the patient has to come an effort to answer. There is also dryness and paralysis of physical level manifesting in severe constipation, dry skin. How the psychosomatic with pathology or with physical general is interlinked. Or in everywhere there is dryness, slowness in all levels, progressing to a state of paralysis and constipation. That is alumina. This is the gist. This is the general trait. This is the general mental state. This is the genius. How the genius of exciting factor, how the genius of pathological general, how the genius of trait, how the genius of mental state is going on in each remedy. Understand these. Ignitia. In modern times, the incidence of neurotic disorder seems to be rapidly rising, and in this sphere, ignitia is particularly useful, of course, only when it covers the symptom totality of the particular case. Modern civilized life, especially in the cities, seems directly to give rise to repentions, conflicts, exposed to the individual to many type of anxieties. The increasing demands of modern life present many problems, and as a result, there is a constant sense of insecurity. Ignatium seems to cover very well the results of such tensions and emotional imbalances. This is the genius of Ignitia. This is the trait of Ignitia. Aurum, the patient is deeply depressed, so much that he is thinking of committing suicide. The thought of death is an outlet of his despair and make him feels better. He is perfectionist. He is industrious. Want to be the first, to be in a high position to be recognized. Once they lose their standards, once they face failure, they feel they have lost everything. Life has no meaning anymore, and then they think of suicide, especially by jumping. Only praying to God can relieve them. This is the genius of Aurum. This you need to understand in each remedy. I'll go somewhat fast. Now, crux of our webinar. So, what is the crux of our webinar is in our efforts to study and understand the complete individuality of the drug, we should naturally proceed and we could do when we deal with the sick individual for to the homeopath to the drug picture and disease picture are only counter images for each other. To study Medica, to understand Medica, the only reliable source is patient itself. Patient itself. Patient will give you whole Medica gist. Whole Medica gist. Individuality comprises of specially inherited characteristic features molded, altered, added to by a particular circumstances, influences to which each person is exposed. Understand these lines. Grab it. We have to study, understand, unravel the interrupt and the cognal and accurate acquired attributes of the individual, subsequently modified by the circumstances. So, every individual is to be studied in his own surroundings, in his own background, in his own actions, in his own reactions, and begin interpreted in that light. Try to understand the own surroundings, try to understand the own surroundings of the remedy from where it is extracted, either the plant, animal, or whatever, his own background, what is the background of the remedy and what is the own action, the reaction. In absolutely the same way, we have to know the study and understand every facet of makeup of each drug to see if that could offer some clue to explain the peculiar activity of the drug. Now, morphology. How a morphology will explain you the remedy. Such accepts as the morphology, the habitat, physical, chemical properties, family relationship, group tendencies, the identity of the substances, the source, the origin, the particular references to the nature of the behavior, or the original substances, either the mineral, plant, animal, the traditional uses, the physiological, the toxical effects, medical, non medical, should be considered and analyzed. Every piece of information that may enhance our understanding of the drug should be collected and collected. To understand Metromedica, you need to understand this slide. This slide will give you the gist of Metromedica. The habitat, the physical, chemical properties, the family relationship, the group tendencies, identification of the substances, the source from where it is extracted, the original particular references, the nature, the behavior, the substances, the toxic effects, the physiological effects, how old school has been used this medicine, what was the crude form of this drug, how it is acted, what symptom it has produced. If you understand this morphology of each drug, try to Google it. If you don't get in Metromedica, try to Google it, the crude form. Use in a proper way. You will get the information. If you understand this, then come to read Metromedica. It will be very easy, very cakewalk to understand Metromedica. Very cakewalk to understand Metromedica. Here you see, belladonna plant grows in calcium-rich soil. That is why belladonna is acute and complementary to calcareous carbonate. This is the morphological interlinking with the complementary remedy of Materia Medica. Understand this. Bryonia alba is prepared from the root. The roots are fleshy, bitter in taste, with nauseating smell, very rough, acid, yellowish white in color. Similarly, Bryonia patient is somewhat fleshy with bitter taste in mouth, yellow, white coated tongue, and all the discharges are acrid. This is the morphology of Bryonia. This you get from Clerk Materia Medica. Try to read Clerk Metromedica general characters first para. You will get it. This information is hidden in Metromedica, where we have ever seen from that viewpoint. Try to see from different viewpoints. Try to interlink the viewpoints. Drug prepared from yellow flowers of gelsemium acts well in jaundice. That is the morphology. The morphology may offer some clues towards the action of the drug, is a most ancient idea from which arises the doctrine of signature. This doctrine has been sufficiently ridiculated, but perhaps it was not entirely baseless. The shape of the plants, animals, and their size, color, structure will reflect their individual. If a patient comes with splenic spleen involvement, spleen pathology, nothing is found, nothing is there, give Sionatus. That is doctrine of signature. Sionatus remedy. This is the beauty of morphology interlinking with Metromedica. Lachesis is prepared from deadly poison of surku, the snake of South America. It remains cruel in winter and wake up in the spring. It passes very offensive black stool. It always protrude its bifurcated tongue. Like, see, if a patient comes and or always talking in front of you and the tongue is outside like this, and Kent has written while talking, the tongue will come interrupt with the teeth like this. That here, that is observation. That could be the patient could be lachesis. Confirm with similarity, the totality. And holding its tongue, it moves upwards, cannot make a knot of leaving snake, it slips. Similarly, lachesis patient cannot tolerate tight bandages, tight clothing, protrude tongue all the time with a bifurcated black streak in the middle. Symptoms grow from below upwards, stool hard, black and foul smelling. This is the doctrine of lachesis. This is the doctrine of lachesis. Again, this paragraph was taken from Clerk Medica. Tarantula is prepared from Spanish powder that is sensitive to drumsticks, drum beats. Similarly, the patient is oversensitive to music, like Theridion. Theridion is from the same family again. Oversensitive to slightest noise is Theridion. With Tarantula as well. And Tarantula is the remedy if a patient dances with rhythm. If there is some there is a rhythmic music and patient starts dancing is Tarantula. Nothing else. That is the genius of Tarantula again. The cunningness, the dissonance you can see in Tarantula. The spider group you can see in Tarantula. Physical and chemical properties. How this physical and chemical properties play a huge role in understanding Metromedica. The physical and chemical properties of drug may be reflected themselves with symptoms. The yellow and red color of phosphorus phosphorus remains as its action on the liver, producing jaundice and its hemorrhagic properties. You must have observed that most of the substance with strong smelling, like ambragracia, asafoetida, crocus, moschus, nux moscata, valeriana, etc., are historical remedies. Someone has asked what is historical. This is historical. This is the historical understanding. Ambragracia. I will tell you Ambragracia, a beautiful genius is, for example, if a patient comes and you have taken the history and patient says, Doctor, na, in my family there is recurrent deaths. 1 month, one in COVID, this has seen. Doctor, in a 1 month, I lost my mother. In the next month, I lost my father, my grandfather, my grandmother. Then afterwards, na, I am no more the person what I am. He is Ambragracia. He is Ambragracia. The exciting factor of Ambragracia is recurrent death in the family is ambragracia. Embracement of elements from embracia is ambragracia. This is the genius. This is the genius. Coming to family groups, the family and group tendencies are also prominent, such the sadness of nitrums. All the nitrums are sadness. The weakness of calis, the neuralgic pain of magnesium families, the sluggishness of carbons, the glandular affections of halogens, the prostration and weakness and exhaustion is acids. One term or one terminology will give you the gist of the remedy. You need to interlink. You need to separate. You need to find the individualization. You need to find the general modality. You need to find the general trait. You need to find the pathognomic general. This is the beauty. This is the beauty. Coming to electric affinities of the remedies, Apis and Thuja seems to act well on void organs like kidneys, ovaries, testes, etc. Argentum nitricum acts on cartilages. Bryonia acts on serous membrane. Cactus acts on circular muscle fiber. The constriction you can see in Cactus grandiflora. Heart constriction. Caged, caged feeling you can see. Capsicum on mastoid process. Ceanothus on spleen. Chelidonium on liver. Digitalis on the heart. Euphrasia on salivary and set glands. Calicab on the lumbar region. Lacnanthus on the sterocleidomastoid muscle. This is the affinities you need to understand. To understand these affinities, try to master boric, the first line, or Fatak Materia Medica of the first para. Understand. You need not to read whole remedy. Try to read one remedy, the paragraph, what it is. On the next day, go for the other book. Try to read the affinity of remedies and make a note of affinity from where it is acting, how it is acting. Magnum acts on ears. Magnum asticum is one of the top remedy for hearing loss. Nitric acid on mucocutaneous junctions, fissures. Onospidium on female organs. Phytoleka on mammary glands, like conium, like philandrium. Quercus on the spleen. Saba cerulata is on prostrate. Staphysagra on splinters and genitalia. Terebinthana in kidneys. Eustilago on the hair and nails. Vipera on the vines. Xanthosylum is on nervous system. Xanthosylum is one of the prominent remedy. If a patient complains of lot of dysmenorrhea, you have given MACPA, some other remedies, etc., nothing working. Use xanthosylum 30 water dose. It acts beautiful. It acts beautiful in dysmenorrhea cases. And the pain is extending to thighs is most prominent key characteristic of xanthosylum. Euphemium on sexual organ, zincum on brain, and so on. Try to collect the affinities of each remedies. Try to match it. Try to interlink. Now, nature of the drug. Drosera is an invitrious plant. Whenever any fly sits on the leaf slowly closes, impresses the fly, and secretes a juice which is able to digest the fly. It is also able to similarly dissolve the bones and glands as if it's in tuberculosis. Further, sheep eating Drosera leaves develop a nocturnal cough and die. That is why Drosera is a well-known remedy for cough at night and for tubercular glands. We Until now, Drosera is the remedy for cough and for tubercular glands. But what could be the background? Why it is? Always question why, when, how. Reading Medica, why Drosera is on acting on cough? Why not on GIT? What could be the background? How it is acting? What is expected? Question yourself. Go in depth and understanding it. Then you will remember. The plant of rustox is said to be most poisonous in rainy weather. That's why in damp weather aggravation, rustox is one of the top remedies. This is the beauty. This is the beauty. Pulsatilla is also known as wind flower, is a remedy for women who repeatedly changes like a wind. Nitramur being salt, produce lot of thirst. Potassium has toxic effect on heart. Kalika present having many heart symptoms. The nature of drug you need to understand. To understand this nature of the drug, question why, where, how. Extract the material from Medica. If you don't understand, try to Google the each word, each terminology. It's our work, it's our duty to make it understand. Is it clear? Is it going well? Traditional and old school usage of medicines. Bellis P used a remedy for injuries. Even after being trampled upon, the flowers come upon smiling. This is the traditional use. Aloes has been traditionally used for inducing abortion because it is able to bring out everything involuntarily, including the stools and rectum. That's why aloes have action on the rectum. The sphere of action is on the rectum. Wufu has been made used to produce impotency by women who find their husband sexually overactive. Again, this was taken from Clark Medica. Stramonium has been given to produce insanity. Opium has been used to produce constipation and a sense of well-being. And when these symptoms are found in the sick, it is able to cure. It is able to cure. Opium for constipation. Stramonium for insanity. It was proven. It these symptoms never bluff you. These are the real clinical indications which are extracted from the crude form, the toxicological source. Naxmostata used by village women to keep their children quiet and drowsy while they are going away from work. Naxmostata. Cannabis is taken by addicts to experience glorious delusions and thesis. Carbovage is used in modern medicine for flatulence since it has a capacity to absorb 40 times of its volume of gas. Now you understand why carbovage is one of the top remedy for flatulence, along with Lycopodium china or Ravenous sativus, etc. Merxol is used in thermometers and barometers to indicate the change of temperature and weather. This is the traditional use of each remedies. Try to grab that knowledge. It is there in our Medica, but we never viewed that point of view. Here, my intention or my limelight to show you that each and everything is in our Medica. We need to extract it. We need to have the passion to read Medica. If you develop that passion and you apply that in patients, you will see beautiful results. The whole satisfaction you will get when you cure a patient with that single remedy, symptom matching, totality of matching. Belladonna. Bell is beautiful, Donna is lady. Was being used to women to produce brightness of eyes and red cheeks so that they may look attractive. It produces all the symptoms in the sick along with hot head and cold extremities. The dilated pupil results in photophobia and the patient seems also visions as in calcarea carb. So calcarea carb is chronic complementary to belladonna and it also has dilated pupils, hot head and cold extremities. Now, pathogenesis of remedies. The constipation of opium is in the proving is not surprising when one knows the drug produces profound depression of motor and sensory nerves and inhibits secretion. The inhibition of secreting glands may result in dryness of the alimentary tract. And even when the rectum is full, there about to complete within 15 minutes. Please do stay. And is visible, it's fine. Shall I continue? Thank you. Thank you. So, remedies. Here, next remedy about these pathogens. Is it fine? It was same as before, right? The screen and the voice, everything is fine. Yes, yes. Thank you. So coming to the symptomology of a drug by imaginatively the interlinking of symptoms by visualizing the underlying pattern. Here I was discussing about silicia here. Understand the core of silicia. How you can understand. Silicia forms the major part of the earth crust up to 120 miles deep down. Just like the earth crust, the silicia patient also get heated and cooled easily. And this is the aggravation by heat and cold. See, all the modalities of the Medica comes from the morphology of the symptom, comes from the depth of the symptom, comes from where it is originated, comes from the where the source it is. That is matching. That is matching. The Silicia patients are also characterized by deficiency somewhere and excess somewhere else. The head and abdomen are big, and the body and limbs are emaciated. There may be deficient growths of bones, rickets, but there may be also extosis, defective healing, excessive granulation, softening, liquefaction. So silicia is more of like caries, hardening of soft tissues that you can see. So these weakening of fibers, these weakening of tissues results in this shyness and timidity, but strong willpower causing stubbornness. See the peculiarity or see the polarity, timidity, shyness, along with that the obstinate nature, the stubborn nature of silicia. That is why the silicia is having white spot on the nails because of their morphology they comes from, because of the original source they comes from. That you need to understand. In this last, it resembles their hair, which looks like thin, yielding, but it's actually very strong. And of silicia is consistent. As the patient is stubborn, so do we find stubborn suppurations, ulcerations. See the stubbornness along with the skin pathology. See the stubbornness in the in the psychic sphere, and see the stubbornness in the somatic sphere. Silicia has peculiar lack of grit, inability to carry out the task fully. This is even reflected in the constipation, where the rectum expels the stool but not fully. So that stool recedes back. This is also called the bashful stool. The shyness of stool, the shyness of psychic of silicia matching. The interlinking is matching. This you need to understand in each remedy. So at soon I'll discuss some lesser known remedies. Gingiber. So why many people neglect these remedies? But these are the remedies comes to your rescue when your many polycrust remedies fails to act. Gingiber, if you open boric medica, from the first line, it treated complete cessation of kidney. In complete cessation of kidney failure, gingiber works well. It was written, it was mentioned in the second line of boric medica. Gingiber and diarrhea from bad water, diarrhea from bad melons is gingiber. Next remedy, this is just for giving you idea how you can study Medica. How important are the lesser used remedies when your polycrust remedies or when your indicated remedies fails to act. Yucca filamentosa. If you give an Naxomica or Chelidonium, it fails to act, then comes to think of Yucca filamentosa. If you open Boric Medica, first line it is written bilious symptoms with headache. Like Naxomica, like Chelidonium, Yucca filamentosa comes to your rescue. Thrombidium, when your Naxomica fails in dysentery immediately after stool, immediately after eating, then the patient go for stool. This was the complaint, given Naxomica but no relief. Think of Thrombidium. It was written in Boric in the second line. Triticum repens for albuminuria, for chronic nephritis. In kidney pathology, triticum repens comes to rescue when your lycopodium, when your sarsaparilla fails to act, fails to act. Everything is in your Materia Medica, but you need to understand and grab it. Understand the genius of remedies. Next remedy, syncorpus. This remedy comes to your rescue in nausea feeling or vomiting in pregnancy. Syncorpus racemosa. If your ipecac fails, if your ignitia fails, think of this remedy, syncorpus. Sedum acre, having very, very pathological action, prominent action in rectum, like fissures. If your nitric acid fails, if your retania fails, sedum acre will rescue for sure. Brand should sedum acre will work. Because this I have seen from my guru and I have own experience these remedies. Sedum acre. Scutularia, school teacher's headache. Sapinoria officinalis. If you give a Naxomica, Lycopodium, Heparsal, Felicia in acute cold, throat complaints, but nothing is helping, Sapinoria will help you. And in Boric it is written, will often break up cold, acute colds, acute corazas, acute throat complaints. Sapinoria comes to your rescue. This is the beauty of Materia Medica. These you need to learn. If you master these, your acutes will be like a hell. It will work wonders. Immediate relief, immediate relief. Gallianthus, in cases of if there are reports and in the reports there is mitral regurgitation with broken non-compensation, Gallianthus works well in 30C. Fusinum, in cortico substance of kidneys with degenerated, useful in cortical nephritis with albuminuria. See the pathological action, see the pathological general, see the location of remedies. Master this. And you may get doubt, doctor, why we can see these remedies, how we can get these remedies idea. My dear friends and colleagues, all these remedies will hidden in the comparison pattern. Comparison. If you open lycopodium, under that read the comparison relationship. Go to that remedy, why lycopodium was compared with so and so remedy, why this remedy is compared with that remedy, what it is matching, how it is matching, what action is matching. Everything is written, but we neglect. But we neglect. Go with Clark Materia Medica at the first line and at the end of the first paragraph he writes comparison joints these remedies, these remedies, or stomach these remedies. Everything is written. We did not ever view from that point. And my intention is you people must be viewing this view what I viewed, what I learned, and that is what I need to replicate here to grow the system of homeopathy. The flourish of system of homeopathy is in our hands. It is in our hands. We can do it. If I can do it, you can do it. Only the passion you need to have. Anantaram uraticum, it also acts well in skin complaints. Cascara, palliative for constipation. With patient comes with rheumatism of muscle and joint pains, having constipation, can be cascara. It was written in Boric that palliative for constipation. Palliative for constipation. Actually, I thought of discussing many remedies from Boric, but it was no time and the disconnection was happened. At last, thank you everyone, showing your patience, staying still the last. And a small request from my side, please share your feedback, what you have learned from this webinar. Each and every one, many people has joined, around 90 was joined, but at present there are 60 people. Please everyone spare 1 minute, share your feedback in your WhatsApp groups or wherever you are, in Telegram, somewhere in Instagram, etc. Please do share your feedback. We are coming up with many more sessions, and these webinars are doing from my wholehearted, from with passion to flourish homeopathy. And I learned from many gurus, and especially the Gigi sir is my guru, where sir has shared his knowledge with everyone, whatever sir has learned. That is what I want to replicate here. That is what I want to share my knowledge. Flourish our system, flourish homeopathy is the only major main aim here. So everyone, please share your feedbacks. Please share your feedback. Spare at least 1 minute and share your feedback. Thank you everyone joining here.